Hey everyone, thank you for clicking on this channel and welcome back to Nursing with Cindy. So today's video is going to be about supplies that nursing students, nurses, you should have for nursing school. And you're going to use this most likely after you've graduated. So your six top things. Of course, this is not the only supplies that you should have. Okay, you should have more, but these are the top 6 that you should have or should carry with you, and then some. Okay, so all right. Number 1, we're going to start off with your stethoscope. If you don't know what a stethoscope is, this is your stethoscope. I got this at on Amazon, and it was around $20. But that's because, and no, it's not a Littmann. This is because it came with this little pouch here, and this is from Everdixie. Came along with this blood pressure unit, which I am so happy it came along with. I didn't know if I would need it, but I mean, I needed it. So, and I love this because, oh, there you go. It shows the directions, says your adult size, kind of tell you like where to place this cuff, so it's like really good. And then here is your meter, and this is the air that you would pump in, and etc. And it also has the knob where you would kind of tighten that so that you can close it as well. And so I really love this kit that it came along with. With it came these changing units of your stethoscope, and it also came with the ear, what is these, like earplugs or whatever, that you can kind of change on your stethoscope setting. If it doesn't feel comfortable to you, you can kind of change that along the diaphragm, the bell, the stethoscope. You can change all of that stuff. So I got that for around $17, I would say, on Amazon. I will link everything that I'm talking about today. I will link it in the description box below. You need your stethoscope because, well, you're going to be a nurse, honey. You need a stethoscope. Your stethoscope is going to be used in order for you to do your head to toe assessments. Whenever you check on your patient initially, you're going to need it in order to kind of check to see heart sounds, lung sounds, making sure those babies are clear, no adventitious sounds. Also, when you go on to your gastrointestinal, genitourinary systems, you're going to be listening to those bowel sounds in the gastrointestinal areas. You're going to be listening to those bowel sounds, so your stethoscope is going to help identify any deficiencies within the body through these diaphragms, bells. You're going to need a watch with a second hand, okay? So I know a lot of us now in this technological world, we have these Apple products, these Apple iPhones, these Mac Pros, etc. And we also have the beloved Apple Watch, all right? You know, and I have one, so I feel like I'm just sucked into this technological world, but oh well. But for nursing school, I guess they're kind of old-fashioned. Well, you know, my school at least, and they don't allow us nursing students to have the digital watches. So they wanted us to go ahead and buy your old-fashioned watch. So I got myself this watch when I was doing this was like my first year, and this is actually like a men's watch. I got it at Walmart, and this was around $7 to $8. But this broke, so I mean, as you can see, like you see that the second, yeah, it's broken. So I went back to Walmart and I got me a new one. Yay! And this works perfectly fine. Don't really need a fancy ass watch. Like, you just need a watch that you can tell the time and it's working and it's gonna help you help your patient. Boom, bada bang. Done. Okay, all you need is just a regular schmegular watch with a second hand, and this was at Walmart again for like $8. Another thing that you're going to need is this planner. Not this specifically, but you're going to need a planner. And as I've stated in my last video, I talked about organizational skills. I talked about how nursing school is going to essentially help you kind of be on top of your crap. This is where like you're gonna be getting your life together. Okay, this is Blue Sky, and this is a daily, yearly, monthly planner, and it goes up for about a year. I have this, yeah, it goes for like a year actually, and I got this for about, I think 13 to 17 bucks. And I remember initially I began by using regular paper, and I would kind of create my own slots. So I would kind of create like my own months, my own weeks, own days, and then I would kind of like write them down, and then like, yeah, that would be my planner, which kind of got annoying until I moved on to a school planner, which became crappy, and then I moved on to another one, which wasn't good enough, and then I came upon this baby. So you have your entire month, right? And you have all of these slots. It gives you all these days. And around here, you would have the upcoming months. And then right here, you have like extra notes. And also, it has lines within them. So you can kind of like write on the margins and everything. And then when you turn the page, you kind of have your days. And it gives you your time. Your timing from like 7A, I think, to like 7P. And these are extra notes, like let's say they can't fit in here, or you've already written, or you've got so much going on, and you just kind of want to write your notes, and so you use that. So I kind of got like a few more months since like we're in August. Yeah, I got a few more months. So, I mean, I'll be going back to Target, and I'll be buying me another planner because that baby worked, and it has helped me throughout this entire program. Okay. Going to need is a pen light. Okay, so I got this pen light, Opaway, it's by Opaway, and it was on Amazon for, I think, like $7 to $8. And it uses LED lighting. It came with 2, and it also came with batteries, not in them, but like packaged in there. So it also comes with a promo code. So these pen lights, I love these because it has these the dimensions here in millimeters, and it kind of helps you, for instance, compare the pupil size. So yeah, and it, you know, that's pretty good. So these are pretty good. I don't know if you can see this pen light. I don't know if this one has lighting in it. Nope. Let's see this one. Which one of these? Oh, this one. Ah, it works. Okay, so there you go. So yeah, this, and of course you need this because you're going to be, when you're doing your assessments, your head-to-toe assessments, your neuro assessments, you're going to need this pen light, especially when you're checking to see if it's the pupils are constricting, if they're dilating, when you move the light away, when you're checking into certain orifices, or like the mouth, checking for those mucous membranes, making sure they're moist and pink. When you're looking into those nostrils, making sure they are patent, septum is like symmetrical midline, okay? And when you're looking into those ear canals, you're making sure that there's no excess cerumen that's blocking that hearing. Moving on, you're going to need a black pen. Yeah, okay, so you're going to need a black pen. To be honest, you're going to need a whole bunch, because when you're documenting, you need to use a black pen. When you're charting, when you're doing whatever, have a whole bunch of black pens in your pockets, on you, whatever, dress as a black pen. Just have a black pen. Do not come to nursing class or nursing school without a pen. Your instructors will be very upset with you, and no one will lend you their pens because everyone loses their pens anyway, so it's like, why give you their last pen? I mean, eventually, they're gonna start being a pen thief, like me. Sorry. Last but not least, shoes. you're going to need shoes. And you're going to need comfortable shoes, not just any shoes, comfortable shoes. For my program, these are my first babies, and my program wanted us to get all white leather shoes, and they wanted leather because, for instance, if a needle fall on your foot, it wouldn't go through just as easily as it would for mesh, and it wouldn't puncture you, and so you prevent an accident. Also, if you have people spilling their emesis, yeah, so get you an all leather shoes, okay? As nurses, you want your feet to stay comfortable as ever throughout the day. You want to feel like you're walking on the clouds, okay? So do as much as possible to get your feet situated, so that way that blood does not pool at the bottom of your feet, okay? And you don't get irritated of walking or have to going to get something for the patients or medications and stuff like that, especially the fact that nurses, the patients are going to be calling you like 24/7. They won't leave you alone because they're sick. And they love you and they want you there and you're so nice to them and they just need company. And so you need to not get irritated with your patients and make sure that your feet is comfortable. And along with that, you want to have comfortable socks. So these are my compression socks. Okay, so you're probably wondering why compression socks, why not just any normal socks? You can wear your normal socks, I mean, sure, but I've learned kind of the hard way that with clinical setting, especially if you're going there and you're there for like, I don't know, let's say 7 hours. And remember, as nurses, we're probably gonna spend like 8 to 12 hours there for a shift. My feet killed me so bad in my last semester that I was just like dying, and my foot actually got like swollen because of all that blood that pooled around throughout that entire day, and it just swelled up and it was very painful. And so I looked into getting compression socks, and these compression socks, I think the pressure is from 22 to 24 millimeters of mercury. They're just like blood pressure, like, you know, your blood pressure, but it's just, instead of it being on your arm and consistently squeezing, it's going to have one setting and kind of just squeezes around your leg, and you kind of don't feel it. It's kind of thick, to be honest, but it's very comfortable when you're moving around because it helps that blood flow, it helps it circulate, and it prevents swelling of the feet and etc. And also you know, yeah, so you need some compression socks. Thank you all for listening to these top 6 supplies. Go get you these things if you don't already have them, and trust me, you can thank me later. And don't forget to like, subscribe, comment about your experiences, about what you're going to be doing with the upcoming semester or fall, anything and everything. And thank you all for watching this channel yet again.